So I don't know if we ever thought that this day was going to come as I look at Phil, because it's been a long 3 years. The U.S. COVID public health emergency is set to end on Thursday, meaning the U.S. will no longer provide many Americans with free COVID tests, treatments, vaccines at no cost. This comes as the World Health Organization made a similar declaration last week, more than 3 years after the global pandemic that claimed nearly 7 million lives around the world. Our chief medical correspondent, Dr. Sanjay Gupta, guided us. Thank goodness for him through it all, the ups, the downs, the masks, the tests, the vaccines, from the very beginning when CNN first started calling this a pandemic.
There are criteria that are somewhat defined to call something a pandemic. And let me just preface by saying, this terminology that we're going to start using now isn't so much to cause panic, but rather to really cause a focus on preparedness.
Dr. Gupta has been here with us, guiding us through all of it. For every pandemic milestone, he joins us again. Good morning. I usually call you Sanjay. I'm calling you Dr. Gupta this morning because that's what you've been for us. Sanjay, you made us feel, you helped us understand something that has been so scary for so many people. And this morning, your essay is so great because you're talking about our country as your patient again. So where are we?
Well, I think for some people, this is going to seem very arbitrary and accelerated, that the emergency part of this pandemic is coming to an end. For other people, they're going to say, hey, look, months ago, maybe even a year ago, I was sort of through this. So it's pretty divided in terms of how people think about this. As you mentioned, the WHO already ended their public health emergency of international concern. The CDC director in this country is stepping down June 30th. And Thursday, the United States is going to end the emergency as well. The way that it's worked is that there's been these emergencies that lasted 90 days, and they've been sort of renewed 13 times. So that last renewal will end on May 11th, and at that point, it's expected not to be renewed again. So that's where we are. I'll just tell you, as you mentioned, Poppy, I sort of thought metaphorically of the country as my patient. I felt like it was the best way to sort of think about this, and I really meant it. If you look at how the patient's doing now, and sort of look at the patient chart, if you will, over the last 3 years and a few months, I can show you sort of where cases are now. In the beginning, when the pandemic was declared, there were just a few cases. Now you can see the cases have really trickled down. You saw some big surges in the middle there. That's when the patient was unstable, ended up in the ICU, needed all sorts of care. But there's about 77,000 cases still a week. To give you some idea. Hospitalizations, again, you're looking at the last 3 years and few months of this pandemic and what has happened. And the numbers are trending in the right direction, about 1,200 people in the hospital right now. And then finally, deaths. Again, when we declared this a pandemic, there hadn't been any deaths in the United States yet, but the trend line was very concerning. You can see that almost straight up line in the beginning, and then the various surges, and now there's about 1,100 people who are dying every week still from COVID. So, you get an idea there. By the way, if you do the math on this, 1,100 people a week, that's about 55,000 a year that would die if those numbers stayed the same, which is basically a really bad flu season. We could do better, but that's where we are right now, and that seems what the country is willing to tolerate.
Yeah, Sanjay, and I'm going to call you Sanjay because you basically became a part of our family and everybody else's family, given the fact we were all relying on you over the course of the last 3 years so often. What kind of changes should we expect to see on the personal level with the end of the emergencies? There's tangible repercussions here.
Yeah, I think, there's a lot of people, again, who are watching right now and are worried. I have people in my own family because of their own pre-existing conditions, their age, they're worried. The tangible things, Phil, free testing and free therapeutics treatments, those things will no longer be free. You may still be able to get those through your insurance companies. The maps that we've been showing where communities spread, where the virus is sort of spreading in some communities at any given time, like those weather maps, those aren't going to be easy to access anymore because that data won't be shared. Vaccines will still be available and they'll still be free. You have to figure out how to get those. But, going back to saying so much of the country's moved on, when you look at the up-to-date percentage of people of vaccines, you're under 20% of the country is up-to-date on their vaccines. By the way, with flu, it's around half the country every year that actually will get a flu shot. So there's not a lot of will to get those vaccines, but they will still be available.
of course, the question is, should people still wear masks? What things can they do to protect themselves? I think should is not the right word, but I still see people wearing masks, and I respect that, and it's their decision. What are things that people should change on Thursday or not?
I think there's a few things. First of all, with regard to masks, I mean, there are people who are still vulnerable. If you're going to wear a mask, wear a good, well-fitting, high-quality mask. Those are the ones that work. I'll tell you a couple things just quickly. I think there's a couple of big lessons here. One is that the United States got hit particularly hard by this pandemic. There's all sorts of reasons for that. But one of the big ones is that we were not very healthy going into this pandemic. We knew that age was a big risk factor, but also pre-existing conditions. And you can look at some of these pre-existing conditions, you know, things, obesity, for example, puts you at much higher risk of this. Having underlying kidney disease puts you at much higher risk of this. Cardiovascular disease, those types of things actually did increase the risk significantly. Wealth does not buy health. Got to keep that in mind. So we need to get healthy as a nation, because if we deal with this again, it'll put us in much better position. I'll leave you on just a quick inspirational note, or at least uplifting note, is that if you have immunity against this virus, if you have access to antivirals like Paxlovid, and you should make sure you have access to that, there's no reason anyone should die of this disease anymore. We have the technology to prevent that from happening.
Wow. To be able to say that. It took 3 years, but to be able to say that is really important. Sanjay, thank you for all of it.
You got it. Thank you.
From all of us. You should read Sanjay's essay. It's on CNN.com.